Patient-centered care is exactly what it sounds like. It's just care that centers around the patient.
To me, patient-centered care is providing excellent care to patients based off of what their expectations are, not based off our agendas as healthcare providers.
Patient-centered care is the whole package for the patient.
Patient-centered care is going above and beyond what we know about the patient, medical history, and what's in their chart, to really learn about the patient personally, about their family and their likes and dislikes, to care for them fully and in a more personal way.
It's amazing. I've been a nurse for almost 13 years, and it was like an epiphany happened when that question was posed. What does patient-centered care mean to you? And it doesn't take any more time out of my day. I have to go in and assess my patient in the morning and look at their vitals and pass their medication. So in just casual conversation with them during their assessment, I ask those questions. What time do you normally take your bath? When are your visitors coming to visit? If you don't have visitors coming to visit, maybe we can sit and talk later, trying to make that time for them and to incorporate them.
I try to picture myself in that bed, and I always have after this many years, and I have been in that bed myself before. And I think a lot of times we get so wrapped in running around, we forget that these patients are out of control, they're away from home, they're worried about the bills, and us running in and out real quick doesn't help.
It was a while ago. I was taking care of a little 90-year-old lady. She was cute as a button. She was very confused, and for some reason she thought I was her mom. So all day she was calling me mom, and then she got upset and was crying, and she asked me to hold her. So I just kind of put her head in my arms right here and held her for 30-45 minutes because she thought I was her mom and she wanted me to hold her.
This was the best unit I've ever worked on because the teamwork is here. If you ask somebody, they're right there with you. If you feel overwhelmed, they're coming right behind you to back you up, and it's just, you feel like a big family here, and you know that our patients are going to be taken care of.
Just in the short stint that I've been here, no one has ever said, when answering a patient question, you're not my patient, or let me find your nurse. Everyone seems to take care of the patients collectively.
Well, teamwork allows the nurse to free up her time to be able to spend a little more personal time one-on-one with the patient instead of doing other tasks that maybe a person in your team could do, so that it doesn't break that extra special time with the patient.
I think the teamwork on our unit really does help the patients. People may think that it's helping us directly as a staff, but it really is great for the patient because it lends the extra hand. It makes sure that things are done maybe more quickly or more efficiently for the patient. Today, for example, I was having Jenna help me with a bath. The patient was having pain when she turned, when I had to wash her backside, but with Jenna's help we were able to turn her together, making it more comfortable for the patient, allowing the patient to not be in as much pain with Jenna's help. And I think even though I needed her help to turn the patient, it really helped the patient see that our teamwork is helping keep her in less pain and more comfortable in a situation like a bath. So I see a lot of that happening every day with the teamwork we do, directly having a positive effect on the patients.
A patient of mine came to me and he said, you guys are doing an awesome job about taking care of me, but someone is in here every 30 minutes doing something. Someone's taking my vitals, then you come by and give me my meds, and then someone comes in and asks me if I want my bath. And I just think that you guys can maybe do a little bit better about coordinating the care that you give.
We need to learn to listen better to the patients and their families, and just what they have to tell us, and then really truly take it into consideration. And I know a lot of times we say, well, as the nurses, we are the basically the last stop before everything gets to the patient, everything gets done, and we're already so much is asked, and we shouldn't have to do this, and really some of that is pharmacy responsibility and some of that is physician responsibility. But really, truly, when it boils down to it, is all of our responsibilities, and we are the last stop and go point. And we will make the difference for that patient. And if we listen, and if we do, then, again, I can only say it over and over again, things will take care of itself.